So can you summarise your findings for us?
Okay, so this young Caucasian gentleman has signs of peripheral neuropathy. He has absent light touch sensation from the knee downwards and absent pinprick sensation from just below the knee downwards, and the same with vibration, and absent ankle reflexes. His gait and power are normal.
Right. Would a Romberg's have been helpful?
Yes, it would have been.
Okay. So what do you think the differential diagnosis is?
The most common cause of a peripheral neuropathy would be diabetes, but also alcohol, and maybe vitamin B12 and some drugs can cause that as well.
Okay, so what investigations would you organise for this gentleman?
I'd obviously want to do a full history and see if there was any history of diabetes and alcohol intake. And depending on whether he did or not have a history of diabetes, you might want to do a fasting glucose or a glucose tolerance test, and if he was diabetic, maybe an HbA1c. And I guess looking for alcohol consumption, that might have affected his liver function, maybe.
Okay. So what management would you be suggesting for this man?
So assuming he does have diabetes, the most important thing for him would be tight glycemic control. So ensuring that he has good education about his diabetes, that he's on the right medication, that he knows how to manage it. And then also things like he would need to see the diabetes nurse at his GP practice.
What advice would she be giving him?
She would ask him to attend his regular appointments, to check his feet regularly, to make sure he's wearing comfortable shoes, and check his feet regularly for blisters and things and ulcers, and maybe do things like check the temperature of the bath with a bit of his body that can feel the temperature before getting in.
What about therapeutic options? Are there any treatments you could give him?
Some people get a lot of pain with this, and I know that things like gabapentin can help the pain.
Okay, any other drugs other than gabapentin?
I guess drugs that are good for neuropathic pain, because that's the cause of it, so things like carbamazepine and things, and obviously the insulin for the diabetic control.
Do you think nerve conduction studies would be useful here?
Yes, they might help with a definite diagnosis, but I think it's important to treat the cause of it, because sometimes they can take a long time to get.
Okay then, thank you. So we'll now just move on to the next patient.
Okay, thank you.